patient asks me what are the vitamins. So vitamins are of two different kinds, water-soluble vitamins and fat-soluble. It's difficult to measure all the vitamins and it will cost a lot. Usually patients go for vitamin B12. I'll tell you why the reason, because many patients are vegetarian. So yeah, so she's vegetarian too.
You get vegan, so it's different.
So it's difficult to absorb and get enough quantity of vitamin B12, and they can have numbness, body pain, neuralgia, migraine, or so it's important for them specifically to check at least once a year the vitamin B12. And if they have a deficiency, they can take supplements such as injections, tablet, or at least sources which can increase their vitamin B12. And vitamin D is of course very important.
Vitamin D. Like recently, my sister-in-law just actually got a test done for vitamin D, and she's prioritizing that, taking her cold sun. I think that's the natural way of getting.
One more thing I want to emphasize, I'll just keep it simple, that many patients, when I ask them, do you have a deficiency of vitamin D, they said, yeah, 5 years ago I did a test and it was low, now it's fine. So I asked them, how do you know now it's fine? Because although sunlight is abundant, we don't have enough time to sit and expose our skin to sunlight. And that's why, like we have a fridge, we buy eggs, bread, these are the daily supplements. Once they are finished, we use them again. In the same way, for vitamin D, after you have done a successful treatment, you need a maintenance dose so that your vitamin D can be always maintained for a good level.
Perfect. Thank you for reminding me that, Dr. Nazir. I actually have to go back home and maintain my vitamin D supplements. Okay, so next up, we talked a lot about diabetes. All right, so let's switch it up a little. Something that's quite prevalent in us women is BP, blood pressure. Okay, can you give me some simple tools on how I can manage my BP levels, at least later in life?
So blood pressure, known as hypertension, it's the pressure going in the blood vessels. Normal blood pressure is around 120 by 80. The blood pressure is always a reading of 2. So 120 is the systolic blood pressure when the heart is contracting, and the lower blood pressure is called diastolic blood pressure when the heart is relaxing or in filling phase. Both have their own importance. Normally it is around 120 by 80, but when it is on 2 to 3 different occasions, if the readings are equal to or above 140 by 90, then it is labeled as high blood pressure. And high blood pressure is so common because most of the time we don't have proper symptoms for high